Hi, my name is Paul Moore. I'm a sixth-year pharmacy student. I'm going to be talking to you a little bit about diabetes monitoring and what we can do as pharmacy interns and pharmacists in this area. Being in the community pharmacy myself, 1 out of 3 of my patients either have diabetes or pre-diabetes, so it's a pretty important thing to know about, to be able to talk to our patients a little bit and to understand what questions they're going to be asking. So the first question that they might ask you is like, should I be checking my blood sugar? I see all these machines for sale. I don't know if I should check or how often I should check. And really, everybody with diabetes should be checking their blood sugar at least once a day, but depending on the regimen that they're getting, if they're getting insulin or other medications, it might be more important. Patients, including if they're on insulin therapy, pregnant patients, patients that are having a difficult time controlling their blood sugar, whether they're getting really high during the days or really low, all of these patients should be monitoring their blood sugar at home. And really, all patients should be at least once a day. Type 1 diabetics would be doing it more often, 3 times a day, up to 6 and 7 times a day. But for your average patient with type 2 with diabetes, once a day gives you a good idea of how controlled their diabetes is. Next question they might ask you is, why should I check my blood sugar? Why is this important? Why can't the doctor just do it when I go see him every couple of months? So blood glucose monitoring at home is pretty much our primary tool for diabetes control. It tells us how the patient is doing, either with their food, with their diet, exercise, and medications, and what we should be doing as clinicians, whether we should be talking to them about how to manage their food intake, portion control, how to add exercise into their routine, or if we should be changing their medications depending on where we see highs and lows in their blood sugar. For a lot of patients, their blood sugar can be like a roller coaster, and with these readings, it kind of gives us a way to predict where the peaks are, and if we know where these peaks are, we can tweak their therapy to do the best for the patient. Another thing that patients kind of get annoyed about is blood sugar logs, because not only do they have to prick themselves and take these numbers and then jot them all down, now they have to keep them all in order, time them with meals and without meals and before bed and in the morning right when they wake up. It can get complicated. So we say keep blood sugar log to try to keep everything organized, and it gives you something to give to your doctor, show your doctor, your pharmacist, your diabetes educator how your sugars are, and kind of keeps track of how the patient would be doing. So, goals for diabetes management. For most patients, the ADA recommends the goals for diabetic patients. Their A1C should be about less than 7%, with fasting blood sugars ranging between 70 to 130. And then after meals, 2 hours after meals, if they're checking their blood sugar, their reading should be less than 180. So these are the goals for most type 2 patients, but each patient will be individualized. If they're very advanced, or if they're very advanced in diabetes, you might have higher goals and then slowly bring them down. If they are younger and have no other health conditions, then you might have stricter goals to try to keep them healthier for longer. Okay, so being in the community pharmacy, we have tons and tons of glucometers on the shelves and tons of different test strips and lancets, and a lot of patients are prescribed these by their doctors. They bring in all the prescriptions, they bring it all home, and then they're like, what the hell am I supposed to do with this now? So for us, either as community pharmacists, as pharmacists in a diabetes clinic, or wherever you are, wherever you're practicing, it's important that we kind of know how to use a glucometer, or at least how to tell the patient how to use it. So the first thing you're going to tell them before they start, they're going to wash their hands or alcohol swab their hands so that they know they're clean. They're going to take their meter and insert a test strip into the meter. They'll also either have a lancet or a lancing device, whichever is more comfortable for them. And then they're going to just massage their finger and prick the side of the finger to get the blood out. You take the test strip and touch it to the edge of the blood, and then it'll get sucked up into the strip, and the result gets displayed on the meter in about 5 to 10 seconds depending on the machine. And every machine is different, so there's going to be different things to talk to the patient about. Whether it's an older machine, they might have to code the strips and type in numbers to make sure that their results are accurate. Most of the new machines, all you have to do is put in a strip and it'll all be done for you. So I mean, it's easy to kind of tell a patient exactly what to do, but when you haven't done it yourself, or if you've never seen it done before, it can still be complicated and kind of hard to explain. So I decided to bring my own glucometer in and show you guys just exactly how a patient should test their blood sugar. So I have my lancing device, I have my alcohol swabs. So first thing you're going to do is take the one that said. Place it in the machine, twist it off, and then it's ready to go. For most patients, you're going to just leave it on the lowest setting, so it just pricks their finger a little bit. For patients that have more advanced diabetes, you might have to put it to a higher setting so that they'll be able to get enough blood out for their reading. Then you're going to take the machine, insert a test strip, push it in all the way until the machine should usually turn on by itself, and it'll tell you that it's ready to accept blood. Alcohol swab the site that they're going to be testing, and then you also tell them to massage the finger so that they'll be able to get blood out. Okay, and then just there you go. I just ate, so my blood sugar is a little bit high, but it kind of gives you an idea of exactly how you want your patients to be testing themselves. Next slide. So what do these results mean for your patient? It kind of just gives them an idea of how they're progressing with their diabetes, or how well their treatment is going. So you want to tell them to record their results. And these results are going to be, they can be looking for trends, and you can also help them look for trends to see exactly when their sugars are going high, what they should be doing, what they should be avoiding. Help them look for solutions. A lot of patients, when they have higher numbers, they get discouraged and they don't want to talk to their doctor about it. They don't feel like that their therapy is helping, so they kind of fall off the wagon and they get even worse, and this can lead to further complications. You want to tell them to talk to their doctor, or at least come to you and talk to you about it, because they need that support as a diabetic patient. And overall, tell them not to be discouraged, even if they have pitfalls in the road. It all will lead them to better health in the future if we can keep them on track now. So overall, the pharmacist's role in diabetes is to just explain the purpose and values and the strategies involved in everything that the patient has to do. So whether it comes to testing, taking their medications, going back to see their doctor, and just their overall health, the pharmacist is probably the person that they see the most for their health care. They might see their doctor every 3 months, every 6 months, or every year. But for the pharmacist, they're going to be coming to you multiple times a month, so it's kind of our position to be able to give them a little bit of boost and kind of show them what they need to be doing, or give them that encouragement. So for med taking, their food intake, their physical activity, and monitoring, the pharmacist can have a role in all of these things for their patient. Motivation, again, is a big key, because we're there for them. They come to talk to us. We have to be open for them to come talk to us. So that's another thing to think about. We also want to negotiate individualized blood glucose goals for patients. So if their blood sugar is very high, and we don't want them to come down too low too quickly, so we can make individualized goals and get them down a little bit every week, and then it becomes something manageable for them to do, and it also gets them to their goal eventually. And then we have to be there to support them emotionally and clinically. So overall, the pharmacist is the most accessible healthcare professional, so we have to just be there for our patients, emotionally, physically, and clinically. Any questions?